Dr. Murrell, here we are in the pandemic,
Yes.
and, while we're all focused on COVID for obvious reasons, okay, that's extremely important, other medical conditions don't go away, and the need for screening doesn't go away. And people have been putting off things like mammograms and colonoscopies. What would you say to people who they know they need to get some of these procedures done, but aren't doing it because they're afraid of what's happening with the pandemic?
The truth of the matter is, and not to scare your audience, is that we still have quite a ways to go dealing with this pandemic. However, surgery centers, hospitals go through an enormous precaution in terms of making sure that you're safe, and you really can't put this off. There have been quite a few patients that I've seen who have had some symptoms but have been putting it off, and I have 2 to 3 that are a little further ahead in their cancer journey because of it. And so it's really important to still take care of the things that actually prevent cancer. Colonoscopy is number 1 on that list.
Dr. Murrell, since Chadwick Boseman's death, a lot of people have been talking about how a young guy at his age could die from colon cancer. Have you been seeing an uptick in patients coming in to get screening? What have you actually experienced?
So I will say that, Mr. Boseman played a lot of heroes in his entertainment career. However, in death, he is an actual hero, because I've had so many people come in, especially younger African-American males, which usually I have to go to churches, I go to community events, and I have to beat the drum saying, we need to get our colonoscopies. You need to come in. And a lot of times when they do come in, it's because the wives make them. I've seen a lot of African-American males come in on their own volition who are between the ages of 40 to 50. And it's very interesting. I've had about 30 come in since Mr. Boseman's passing. And I will say that in about 75% of these gentlemen, I found polyps. I found precancerous polyps that if they would have waited, these could have turned into cancer. It's very important, Dr. Ian, as you know, and I've explained to Kevin, is that we talk, and this is African Americans, Caucasians, any group, talk to their children about their medical history. So it's not even speaking about whether or not you found colon cancer, but even if you found a polyp, you should tell your children that, because then they would get their colonoscopy sooner. My father got his colonoscopy, and he's had about 5 to 6 colon polyps. So I knew to get my colonoscopy at 42 as opposed to 45, which is the recommendation. They found a 2-centimeter high-grade dysplastic polyp in myself, in me, on the right side. And luckily, it was able to be removed during the colonoscopy. Now, it was hard for me to remove my own polyp during the colonoscopy, but it was done.